Now we call upon Professor Praveen Sharma for his talk. Professor Praveen Sharma has more than 35 years of experience, teaching experience, clinical biochemistry and lab management experience. He has around 100 publications in various national, international journals, and his recent interest for research are diabetes, metabolic syndrome, atherosclerosis, antioxidants and lead toxicity. He has received many awards. Few of them are GS Seth Medical College Award, Avdesh Saran Memorial Oration Award. He has been awarded with Merit Award by Rajasthan government in 2002. He is a past president and fellow of Association of Clinical Biochemists of India. He has also served as member of NABL. He is NABL assessor also. He is editor-in-chief Indian Journal of Clinical Biochemistry and chairman corporate wing of ACBI. Dr. Sharma is director of National Referral Center of Lead Project in India at Jodhpur. Presently, he is professor and head Department of Biochemistry at AIIMS Jodhpur. I invite Dr. Sharma for his.
Good afternoon, everybody. As most of us, we are aware that this center, AIIMS Jodhpur, is recognized as National Lead Referral Center by NRCPLI. And we have been conducting a lot of work on lead toxicity in populations. So looking to that, I thought I must share some experiences with you, how these heavy metal can contaminate your food. And most of this contamination is through polluted air, water or soil. And when I talk about the soil, naturally, it is going to add something to your food where everything is grown. And when your food is contaminated or infected by microbes, effect would be immediately. You will fall ill, you will have some clear-cut manifestations, symptoms, and you will fall ill. What will happen if you are contaminated with, or there is a toxicity through these heavy metals? It is slow poisoning. It will take a long time. By the time your organs are affected, perhaps you would not come to know. So this is a very important heavy metal toxicity. And I will be talking about the lead. Lead, one of the important heavy metal. It's a beautiful metal, as you all know, perhaps if you have seen. This is lustrous, shining, bluish metal used in various consumer products and manufacturing. Lead can be found in lead-based paint. Most of the paint for shining purposes are based on lead. Most of different type of lead compounds are mixed in paint. Contaminated lead can come to your food through the contaminated soil. Household dust can also have lead particles. Lead glazed potteries, your pottery looks very shining. It is polished with lead. And inexpensive jewelry is also polished with lead. Children are most vulnerable group. Children absorb lead more readily as compared to adults. All children are susceptible to lead irrespective of one is from urban area or rural area, poor or rich. They all are vulnerable. How lead can enter your body? Through eating, ingestion. Lead particle and dust on your hand can add lead to your food. Transfer to your food and drinking water also, similarly. Like a smaller child keep on sucking their finger. Lead is available on in dust and floor. Very well, this can be transferred to their body. 20% of lead is absorbed in adult, where 70% of lead absorption is in children. And this increased absorption is also associated with iron and calcium. Low iron and low calcium will promote the absorption of lead. Then lead can also enter your body through inhalation. And this is again more in children. Because lead available in dust, on soil, where small children breathe in that lower zone, will inhale more of the lead. Skin, of course, lead can enter through skin, but only in case if there is a wound. Other lead normally doesn't enter your body through skin. So far the turnover of lead is concerned, half-life period is from days to years. Half-life of lead in blood and soft tissues is around 20 to 30 days, where in case of bone, it is 20 years. Once it is deposited in the bone, it is always permanently there. In case of their over turnover requirement of calcium, the lead will come into the blood and would cause increase in BLL level, blood lead level. It is excreted through 90% through renal and around 10% through biliary, through bile. And maximum excretion is about 3 to 5 microgram per kg per day. And intake, if the intake is more than this 3.5 microgram per kg per day, naturally it is going to cause toxicity or lead poisoning. Among the various signs and symptoms, tiredness, sleep problem, dizziness, irritability, nervousness, headache, a lot many, signs and symptoms are associated with lead toxicity. So, similarly, there are many, when so many signs and symptoms are associated, naturally they are associated with different system of the body. So, lead practically affect most of the system of the body. Brain and nervous system, reproductive system, renal system, circulatory system, skeletal system and muscular system. Almost every part of body is affected by lead. So this is how when lead level increases, it keeps on affecting different organ and system. Now this is comparison between the adult and children, when lead level increases in blood and how it affects different part or different organs of the body. Besides these other effects are learning disability, speech and language problem, behavioral problem, hearing damage, pregnancy complications and concentration problems are associated with this. There are many studies, prospective, cross-sectional, meta-analysis, and they have all concluded that the increase in lead level is directly affected to IQ. With every 10 microgram percent increase in lead is associated with 2.5 point IQ scale. Now, what about the nervous system? It affects, it causes damage to nervous system can be permanent. Lead can damage the brain and destroy brain cells, can result in depression, irritability, forgetfulness, clumsiness, learning problem. High exposure can result in hallucination, coma, and even death. It has also been studied that adults who were exposed to lead during their childhood had smaller brain volume was smaller as compared to those who were not exposed to lead in their childhood. Lead may act as surrogate for calcium and disrupt calcium homeostasis in the body. Lead affects virtually every neurotransmitter in the brain. Lead binds to enzymes that have functional sulfhydryl group. All enzyme which has sulfhydryl group, lead would bind to that. And you must all be knowing from where the sulfhydryl group comes in enzyme. Our student must be knowing this. Sulfhydryl group is associated with which amino acid which is part of enzyme, cysteine, yeah. So, wherever there is a sulfhydryl group, lead would get attached to it and make it non-functional. Lead may also substitute for zinc and some enzyme, zinc finger protein. Zinc finger protein, where it is located? Yeah. So it can add to that level. It can also interfere with the neural cell adhesion molecule, which may contribute to the learning deficit. Fetus, infant are more prone due to the immaturity of blood-brain barrier. So it is practically affecting every part of the nervous system, right from the enzyme to blood-brain barrier. It also affects blood. It also causes anemia. Lead damages red blood cells, prevents cells from carrying oxygen. It also interferes with the hemoglobin synthesis. Lead has multiple hematological effects ranging from the increased urinary porphyrin, coproporphyrin, delta aminolevulinic acid, ZPP. Likewise, it causes anemia. And its effect is more on heme synthesis, decreases the level of LAD dehydratase. These are two important prominent enzymes, ferrochelatase and LAD. Two are the two important enzymes where it this affects the heme synthesis. It also affects bone. It gets deposited in bone. Lead from the blood is deposited in bone, prevents calcium release into the blood, blocks the production of the new blood cells. Bone and teeth stores 95% of lead in the body. Lead is stored in bone tissue for over 30 years. Whereas in soft tissues and in blood, it remains, half-life period is only 20 to 30 days, where in bone it is 30 years. And under stress, lead is released from the bone in place of calcium. Lead will come into the bone, into the blood. So far as the male reproductive system is concerned, decreased libido, infertility, damage to sperm, increased spouse chances of miscarriage, premature birth and birth defect in children. Most of these changes are associated with oxidative stress. Again, oxidative stress, if you look at the enzyme, glutathione is involved in oxidative stress, SH group, that get attached to the SH group, leading to oxidative stress is one of the mechanism behind this reproductive effect of lead on reproductive system. The effect of lead on female reproductive sex system, again through oxidative stress. Reduced fertility affects menstrual and menopause. Lead passes through the placenta to fetus, may cause brain damage to fetus, may cause miscarriage, may be released from the bone back to the blood. Now, what is the source of poisoning, lead poisoning? Occupational, which comes from the lead smelter, painter, decorators, battery manufacturers, tinted glass workers, jewelry makers, bronze workers, etc. These are the occupation. They are the people affected most by lead toxicity. Then environment, paint, water, food, air, dust and soil, they contribute to lead toxicity. Other very important, traditional remedies, which include Ayurvedic remedy. I'll come to that part later, that how this lead is a part of Ayurvedic medicine. Surma, coil, cosmetic, kajal is important, contains a lot of lead. Lead shot, lead glazed ceramics, foreign body ingestion. These are the few of the important. Lead acid battery. Almost 80% of the lead now used in many parts of the world is for production of lead acid battery. But its recycling is not tuned to its production. It is not that 100% of this is recycled. A lot of this is being thrown and adding lead to the soil. This is how this causes lead toxicity. And this is tinted glass, painting, beautiful paintings with yellow color and all that. All, gives you lead poisoning one or the other day. Lead in water, largely from lead pipes, soldering, fitting, old pipeline contribute to lead in water. According to WHO, maximum water lead content allowed is 10 microgram per liter. That is 10 ppb, part per billion. However, US has been slightly liberal and given this target tolerable limit to 15 ppb, 15 microgram per liter. The amount of lead dissolved from the plumbing system depends upon several factors: presence of chloride and dissolved oxygen, pH, temperature, water softness, and standing time of water in the pipe. Acid water, acid pH will leach more lead from the pipe. The level of lead in drinking water may be reduced by corrosion control measures. To control corrosion, acidity of water will be decreased. So, amount of lead leaching from the pipe would be less. What is the Indian scenario if you look at? 33% of the over 370 sample were collected from top 26 cities of country and tested positive for harmful content of lead. Out of these, 31% of the samples failed to adhere WHO guideline. Mean lead content was more than 10 ppb. Whereas 2% of the samples failed to meet even the lenient Indian norms, which is 50 ppb. Indian norms is 5 times that of WHO. Whereas, so far as the blood lead level is concerned, we follow WHO guideline. Blood lead level should not be less than 10, or in children, blood lead level should be less than 5 microgram. Whereas in drinking water, we are so lenient that we have given this limit to 50 ppb. Where it is going and how it will affect? Naturally, it's going to increase your blood lead level. Environmental lead exposure, paint is the most important factor. Before 1960, up to 40% of lead in paint content used to be, in paint, lead used to be 40%. Domestic paint acceptable limit is now reduced to 90 ppm as per US standard. But lead paint remains in many home, wall, furniture, toys, old lead. House has not been repainted. With old paint, you know, this content used to be 1000 ppm. Lead exposure from the paint. Ultimately, lead from the paint is going to have to lead into the atmosphere in the form of the dust, and naturally we are going to inhale and will add to lead toxicity, lead poisoning. Analysis of lead in paint in India revealed that 80 new paints used in home has very high lead level, in fact exceeding the level of 1000 ppm, whereas USA, WHO, this limit is 90, less than 90 ppm. And lead sold in India is 1000 ppm. The most common application for the paint and coatings are lead carbonate, white lead, white pigment used in house paint, lead acetate used in the paint, varnish and other coating for shining purposes. This contains lead. Lead oxide, you all must have seen that before painting your iron door, you apply lead oxide, red color, then you paint this so that it doesn't get dust, rusting, to avoid the rust. Is lead oxide. Gray or blue lead used on ship for corrosion control. Lead carbonate used on highway parking, structure, etc. This is lead chromate, yellow color, nice signboard on highways. Your road becomes illuminated when you travel at night, full of lead. So this shows this yellow color contains the maximum amount of lead as compared to other colors. Beautiful ground for playing children. Various rides are available in garden. Painted red and blue, red and yellow. And with time over the period, this yellow color gradually removed, or by continuous using them, by holding them, young children play with this and taking this color through oral route. Very dangerous, these rides. Look at this. Where this yellow color is gone. Definitely it must have added to the children's ingestion system, must have gone into the body. Ayurvedic traditional remedies, mercury, lead, thallium, arsenic are added to various Ayurvedic medicines. 40% of 6,000 medicines in Ayurveda contain at least one of the heavy metals. Heavy metals are normally added to increase the potency or efficacy of the drug, Ayurvedic medicine. Or these drugs are used for chronic disasters, so there is a greater risk for heavy metal accumulation. We have seen people taking Ayurvedic medicine. They take this medicine for the long time. It is not like that you take antibiotic for 5 days and stop this. Don't take more than that. Okay. Ayurvedic medicine is taken for a long time. So there is a continuous accumulation of heavy metal in the body. This is a long list of Ayurvedic medicine, and you will be surprised to know there are certain drugs which have 37,000 microgram lead per gram of drug. 37,000 microgram lead per gram of the drug. 37 milligram per gram drug. So this is definitely not safe dose. The lead paint in home built before 1978 place children at the risk for lead poisoning. The older the home, the greater the risk for the lead hazard. From where normally lead is found in home? Windowsill, doors, surface, porch, railing, fan, bare soil, floor where dust can settle. Lead in India is most commonly used but least seen. Users seldom are aware of its presence in day-to-day practice, and since the attitude of common man is nothing happen and why worry, chalne do, kuch nahi hota hai. But this do affect long time. It requires, definitely as I said, it is not like microbe infection that manifested very quickly. Effect of lead would definitely come, but it will take long time. So chronic exposure to spices and cultural powder may cause elevated blood lead level. A majority of cultural products contain lead up to 1 microgram per gram, and some sindoor contain extremely highly bioaccessible lead level. This is one of the study which has given then in these products, in US brand, the lead content is 0.19 microgram per gram, whereas in Indian brand, this content is more than double. This content is more than double. This is comparison of spices. Spices sold in USA has low lead level, where the same spices sold in India has higher level. This again food and spices, mean concentration of lead in spices, food stuff and cosmetics. This sindoor sold in the market, look at the concentration of lead. Of course, I don't say that we eat sindoor, but it can definitely go through the oral route. Look at the content. Calculate this, 559,000 microgram per gram. Almost 50% of sindoor contains lead. बहुत लगा रखा है. You use lead sindoor every day. Similarly, this is Indian study which have shown lead content in spices. This is lead content in spices, black pepper, chaat masala, chili powder, curry powder, garam masala, turmeric powder, all contain lead. So some food we consume contain lead. Water we drink contains lead. Some medicine we take contains lead. Milk, chocolate, candy masala powder, turmeric, ice cream, all also found to contain lead. This is one of the studies we read just 2 days back. Even chocolate contains lead. And the particular brand of, what was the name of chocolate? Hershey's chocolate. Most of us are fond of that chocolate. That also contains lead. Because the coconut procured for this making of this chocolate came from Nigeria. The coconut, water used for making chocolate was procured from Nigeria. Various vegetables examined also contain lead. Either it has come through soil or lead is used for polishing. How beautiful shining brinjal, which is available on shop, is only because of lead. Beautiful tomato, shining, is because of lead, not natural. Lead intake should not exceed 20 microgram a day, or if I say 250 microgram a week, not more than that. Otherwise it will increase your blood lead level. So children are they are at risk. I already talked about. Testing is blood lead level. Blood test is used to check the lead exposure. Venous blood is taken. Finger prick can also be used to estimate blood lead level. What is the acceptable blood lead level? No level is considered safe. However, children's blood lead level in children should not be less than 5. In adults, it should not be less. It should be less than 10. In children, this should be less than 5. So this is how this increased level is associated with different diseases or organ damages. These are other tests, blood tests, X-ray. They are used so as to know lead toxicity in the body, or if bone is affected. Treatment: remove the lead sources from the environment. Treat coexisting iron and calcium deficiency. If the lead source cannot be removed, seal those sources. Therapy, I am not going to touch. Chelation therapy is there, but removal of lead. So there has to be a global policy. Lead poisoning is 100% preventable. Lead-free society may not be possible, but we need lead-free society. We have done some work in Jodhpur. And we have examined around 200 school children so far. Around 35% children have been found to have blood lead level above the cutoff. This situation is not encouraging. Thank you very much.